Hey, what's going on? This is your boy, Dr. Collins, on one of my segments, Ask Dr. Tooth. Listen, I'm sitting here in my office, Manville Dental and Implant Center, located in Manville, Texas, Houston, Texas. You know, with your boy from Shreveport, Louisiana, Polk City, baby. Listen, today we're gonna sit and discuss one of my favorite topics, implants, and why is there a need, all right? One of the things that I want to kind of show you, a lot of times, especially when you have dentures, right? Those of you who have dentures, always know this and understand this. I don't care how old you get. I don't care if you're 90, 80, doesn't matter. If you have dentures or if you start to extract teeth, you're gonna have some bone resorptions, all right? I'm gonna show you something real quick. This right here is a cool little example of how bone normally starts and then it actually shrinks to a point. And this is someone who's completely edentulous. It's one of my old patients. I'm just joking. No, but this is actually a models of, you can see how your bone just through time deteriorate. All right. Well, the same thing also with someone who has just a tooth that's extracted. The people in dentistry says that anytime that you have an extraction, you lose between 40 to 60% of your bone. I don't know. That's what they say. I'm not a scientist. But regardless of what happens when you extract a tooth, you lose bone. So how do we maintain bone? Well, you can have a patient who's 90-something years old, but if that patient has had no gum disease and has had no extractions done, that same patient, if she's healthy, could have the same bone as when she was a child, when she was young, okay? So what happens is when you start to extract teeth or you have gum disease, you lose what? Bone, all right? So why is implants important? Because implant, all it is, is a titanium root. That's it. That's the simplest way to put it. It's your roots, but it's titanium. That's all it is, okay? So what we're trying to do is replace the roots so that way the implant itself can do what? Embed itself in bone so you don't lose bone unless you get gum disease of the implant. Just like you can get gum disease of a tooth, all right? So there's several different things that we can do in implantology. One of the things we talked about again, dentures, right? I'm gonna show you something. If I put a denture in your mouth, and these are people who have no teeth at all, that's what a denture is, right? If we put denture in the mouth, you have the abilities to do what? Shrink. Same thing here. Here's your teeth, and you can see on the side view that you actually are losing more bone. All right, now, why does that matter? Well, if you have a denture in your mouth, I don't care. If you ain't got no bone, the denture is not gonna hold on to anything. It's just gonna, all it's gonna do is, if I'm a tooth, let's say for example, I got something between my legs where I can't move, can I? But if it's flat, I can do the moonwalk, right? So at the end of the day, if you don't have any bone support, guess what? The dentures won't fit, all right? Those who have just a missing tooth, if you don't have a tooth there, then things start to shift. If I'm a tooth here, and I'm a tooth here, and I'm touching right here, but if I decide to pull myself out the way, guess what? This tooth is gonna start to move what? Downward, all right? Causing problems. Also, if I'm a tooth here, and if I'm a tooth here, and I pull myself out the way, this tooth, then this guy is going to start to move sideways, causing a little undercut right here. So my point is, it's extremely important that you have all your teeth, and it's important that you maintain your bone. So that's what implant is. Implant is a titanium root, right? And all we do is we're placing it in bone. Now, one of the biggest things that we always get is, Dr. Collins, is it gonna hurt? Well, I mean, you're doing some slight surgery, but back in the days, we had to cut so much tissue. Bone itself is dead. It doesn't have any nerves that's actually in it. The nerve is actually canals that go through the bone, but it's not attached to the bone. For example, if I go and I hit my knee on this nice big old brick right here, rocks, it's gonna hurt for a quick second, but then it'll be all right. But if I do a small little paper cut, right, that paper cut can hurt for days, right? So what happens is, again, it's the bone, it's the tissues around the bone. If I break my leg, it's not necessarily the bone that's hurting, it's the surrounding tissues that are hurting. So yes, implants can hurt slightly, but what happens is most times when we place an implant, we're not removing a lot of tissue, we're just putting it right to the bone. And a lot of patients, not all, we never want to say all in medicine, period. But a lot of patients don't have a lot of discomfort anymore because of the ease of the surgery. We have certain ways we can do these things now. All right, on another subject, as far as denture is concerned, there are several ways we can actually place implants into dentures. We can do what we call the same day teeth in a day kind of thing, where we actually will screw the prostheses onto the, we call edentulous, that means somebody who ain't got no teeth, mouth, all right? So we actually, this is their mouth, and we'll get something like this, and we'll screw that in place, all right? That doesn't come out until we take it out to clean it, all right? Patients wear that every day like it's their natural teeth, all right? That's one way to do that. Place an implant into your bone, and then put this apparatus on top of it and screw it in. That's called a hybrid screw retain prosthesis, all right? Call me on that. If you want that, that's a good price, so hit me up on that. All right, the next thing is we have here, I call it my snap-on denture. This right here, you can see the implants actually inside this plate. This is supposed to be like your mouth and your bone. The denture, though, is snapped in place. I don't want to break it. Hold up. See how strong it is? I need to get my Wheaties. I gotta go back to the gym. All right, listen. So you see, there's the implant here, and these little screw things are called, we call it the abutments that's actually placed inside the implant. And the denture has a couple things inside here, and it actually just pops in place, snaps in place like so. And that's a snap-on denture, all right? My point is, these are the ways that you can maintain bone and also retain the dentures inside your mouth, okay? For those who have dentures, this is the way to go, all right? What's gonna happen is, I don't care if you're older or young, if you have missing teeth, especially dentures, you will lose a lot of bone. And I'll tell you this, my last thing, I had a Medea. I called mine Medea. You might have called yours Nana or whatever. And we had an Aunt Tootin for me, or Aunt Willa Mae, or whatever. Those people all had dentures, right? But they only wore them dentures when they went where? They wore them dentures when they went to church, or they went to the store. But when they got to the house, they put the things in that old mason jar with that vinegar in it, and left them there. You had to go, Medea, put them teeth in your mouth, please. Boy, go shut up. Anyway, listen, at the end of the day, man, implants is the way of the future, man. It's here now. They're not as expensive as it used to be, man. Give me a buzz. You can follow me. Follow me at Manville Dental and Implant Center as well. I appreciate you listening to me on my segment, Ask Dr. Tooth. I'm Dr. Collins. Appreciate it.